Bismillah ar-Rahman ar-Rahim. Today, our lecture will be about introduction to orthopedic and trauma. My name is Samir. I am Professor of Orthopedic Surgery in Mansoura University. The very first step towards success in any occupation is to become interested in it. So, orthopedic surgery is a very interesting surgical subspecialty which focuses on diseases and trauma of the musculoskeletal system. The musculoskeletal system consists of bones, joints, ligaments, tendons, muscles, and nerves. And the term orthopedics, coming from the Greek words ortho meaning straight and pedia meaning child, so that means straight child. Orthopedic surgery currently has evolved into a very specialized surgical subspecialty with different treatment options, starting from simple plaster of Paris to a skillful, complicated surgery. We have a lot of orthopedic subspecialties all over the world, and especially in Mansoura, which include pediatric orthopedics, ankle and foot surgery unit, reconstruction and deformity correction unit, surgery of the upper limb and the hand unit, spinal surgery unit, tumor unit, arthroplasty unit, trauma surgery, and finally knee and sport medicine. We will have these topics during our course. Congenital and developmental abnormalities like congenital talipes equine virus, developmental dysplasia of the hip, infection like osteomyelitis and pyogenic arthritis, some rheumatic disorder and arthritis, metabolic and endocrine disorder like rickets, osteoporosis, tumors and lesions that mimic them, neurological disorders and muscle weakness like cerebral palsy or polio, injury and mechanical derangement like fracture, dislocation, and fracture dislocations. So let's go from the start. How can we classify bone? Bone, as regards macro macrostructure level, can be classified in several ways. One of these ways that is position. So we will have axial skeleton, which are the bones forming the axis of bone, like skull, ribs, sternum, and vertebrae, and appendicular skeleton, like bones forming a bench of bone, like upper bones of the upper limb and the bones of the lower limb, including shoulder girdle and pelvic girdle. Other classification, we can, according to the shape of the bone, we have long bone, short bones, flat bones, and irregular bones. Also, according to the macro level structure, bone can be classified into cortical bone or compact bone and the cancellous bone or sponge bone, as you see in the figure. So if we see here a structure of long bone, we can divide it into epiphysis, diaphysis, and metaphysis. And inside the bone, we will have medullary canal, and it is covered by periosteum, and inside we will have endosteum. So the endosteum is the inside part of the cortical bone. What about the structure of short, irregular, and flat bone? We will have thin plates of periosteum covered compact bone on the outside, and the endosteum covered spongy bone on the inside. There is no diaphysis or epiphysis in flat bones. As regards microstructure of adult bone, the unit of bone structure is called a lamella. Lamellae are bundles of collagen in parallel surrounded by mineralized matrix. There are spaces between layers called lacunae. Lacunae contain osteocytes, and there is canaliculi, which are fine canals spread from the lacuna. Also, there is interstitial concentric lamellae. Bone composition. Bone consists of 1/3 organic, other 1/3 mineral, which is inorganic, and the last third is water. So we have collagen fiber and non-collagen. We have mineral in the form of crystals of hydroxyapatite, which is composed of calcium and phosphate, and we have water. We have also different cells: osteoblast, osteoclast, osteocytes, and bone lining cells. To understand the different motions of the joints, we should know the three traditional planes of the body which correspond to the dimensions of places. We have sagittal plane, or the anteroposterior plane, which divides the body vertically into left and right half of equal size. We have a coronal plane or frontal plane or lateral plane, which divides the body equally into front and back half. And finally, we have transverse plane, which divides the body equally into top and bottom half. The reference axis around which movement takes place is the frontal axis, sagittal axis, and longitudinal axis. These are different motions which can occur: abduction, that's say movement away from the midline of the body; adduction, the reverse; circumduction, movement of a joint in a circular motion; and then pronation and supination, which stands at turning the head so that the palm faces downward or upward; and rotation, which means movement along the longitudinal axis of the limb. Now we will illustrate some terminology as regards axis deviation. Varus, as we see in the above picture in the right elbow, means deviation towards the midline. So this is what we call cubitus varus in the above picture. Okay, valgus means deviation away from the midline, as we see here in the bottom figure. The left elbow show cubitus valgus. Also, varus and valgus can occur in the knee, and you call it genovarum or genovalgus. Can occur in the hip, and you call it coxa vara, coxa valgum. Okay, another terminology is torsion. Torsion means rotation in its axis. So we will have internal torsion, if rotation occurs in an inward direction, and external torsion. We commonly see these cases in children, and we call it the walk with foot directed inward or with foot directed outward. So we will call it in-toeing gait or out-toeing gait. So this is genovarum, genovalgum, and right coxa. Another terminology we will use is version. Version is angle of inclination of the long axis of the femoral neck with reference to the transcondylar plane of the distal femur, as shown in the figure. Anteversion, it has two types. Anteversion if inclination is anterior, and retroversion if inclination is posterior. Actually, anteversion is present at birth at a degree of 30 degrees, and it decreases progressively during growth until it becomes between 5 to 15 degrees at adult stage. Anteversion is more common in women than men. As regards deviations of the axis in the spine, we have normal cervical lordosis and lumbar lordosis. However, if it exceeds certain degrees, we will have a disease of lordosis or a disease of kyphosis. Also, we have thoracic kyphosis, normal thoracic kyphosis. So kyphosis is excessive backward or posterior curvature of the spine, while lordosis is excessive forward anterior curvature of the spine. Both of them can be, if not excessive, it can be normal, but if it is excessive, it is abnormal. Scoliosis is abnormal deviation. It is sideward or lateral bending of the spine. We have also some terminology as regards the foot. We can have pes planus, okay, which means that it is a flat feet or the normal arch of the foot is lost. Or pes plano valgus. Pes means foot, okay? So pes plano valgus, we have loss of the arch of the foot, and also the foot is deviated outward. Pes cavus is the reverse of pes planus. The arch is exaggerated. Pes cavovarus, we, along with exaggerated arch, we will have deviation inward of the foot. Equinus means that the foot is fixed in plantar flexion, and the opposite is the calcaneus. The foot is fixed in dorsiflexion. Equinovarus or equinocavovarus or calcaneo valgus, all of these are combinations of deformity. A common example you will have during this course will be congenital talibus equinovarus. What does that mean? The elements of deformity of congenital talibus equinovarus are cave, mnemonic cave. So C stands for cavus, A stands for adduction, V stands for varus, and equinus stands for plantar flexion deformity at the ankle. As we mentioned before, cavus in this case will be increased height of the arch of the foot. Adduction will be of the forefoot at the mid-tarsus and tarsometatarsal joint, as you see in the pictures blue. Also, a varus of the heel occur at the subtalar joint, while equinus occur at the ankle joint. So, every element of deformity occur at a different joint. Okay, now another important information we should know are the types of joints. We have fibrous joint, cartilaginous joints, and synovial joints. Fibrous joint may be sutures, like those in the skull in babies, syndesmotic, okay, like those in the inferior tibiofibular ligament. Cartilaginous may be synchondrosis or amphiarthrosis. Or synovial joint, like those of the hip, of the elbow. It may be the synovial joint may be with limited range of motion, like that of the elbow, or with more range of motion, like the hip and shoulder joint, which are ball and socket joints. Now we will discuss some devices and implants we are using in orthopedics. Let's have an example with fracture humerus. This is 2 lines of treatments which we do closed adduction and external immobilization. We can here use U-shaped slab in the above picture. It is U-shaped because it takes the shape of the arm itself. Or we can have cast brace, which is bought from medical companies, or we can have what we call hanging cast. So now we have different options for implant devices which we use. It is slab or cast brace or cast. Also, some surgical procedures we should differentiate between ankylosis and the arthrodesis. Let's start with arthrodesis. Arthro means joints. Desis means surgical fusion. As in this picture, we have here surgical fusion of the hip. Okay, so we call it arthrodesis. Ankylosis is some form of fusion, but it is due to infection. So the patient have fusion at the joint because of infection. It may be in sound position or not. Arthrodesis, it is surgical procedure we do to have painless hip in a good position, but actually we don't have any motion in this joint. Ankylosis, we try this patient which has infection and have destruction of the joint, we try to have the joint in best functional position, and it may end with ankylosis like this joint. We have ankylosis at the elbow joint. Key wires, as we see here, can be used in different situations. In this situation, we use the key wires in supracondylar fracture humerus. Also, we can use it in fracture distal end radius. Okay, so we have different indication for key wires. Other methods of fixation, we can use plate screw, or sometimes we add key wires to have more stabilization. This is another example of special implant, which is dynamic hip screw, which can be used in trochanteric fracture or femoral neck fracture. Also, multiple cancella screw, which can be used in femoral neck fracture. This is what we call locked intramedullary nail. Why we call it locked? Because we have the nail itself, which has been fixed by 2 screws in the proximal part and 2 screws in the distal part. So these transverse screws fix the bone and the intramedullary nail. The lateral view here is the same as the anterior posterior view, but we can't see the proximal screws or the distal screw because we have it direct lateral view. This is what we call external fixators. It is a bar used with 2 chains screws in the femur, in the bone itself, here in the tibia. External fixator in the tibia. What are the indications of external fixator? We can use in open fracture, in lengthening, or in correction of deformities. This is some form of a splint or brace, like orthosis. There are many operations which we have used in orthopedic, like arthroscopy, just an operation to directly via joint with minimal access through a small wound. We can have arthroscopy of the knee, arthroscopy of the hip, arthroscopy of the shoulder, arthroscopy of the elbow, arthroscopy of the ankle, arthroscopy of the wrist, and even some joints of the thumb. Osteotomy means surgical cutting of the bone. Okay, so today we have a lot of terminology we use, like arthrodesis, ankylosis, osteotomy, arthroscopy, some of terminology to make you familiar with the curriculum you will have in next lecture. This is arthroplasty, okay, meaning removal of a joint and put a metallic joint, either in the knee, in the shoulder, in the hip. Here we have, this is arthroplasty of the hip and the arthroplasty of the knee. This is some form of implant we used in arthroplasty. Okay, now we finished the lecture, and if you have any questions regarding this lecture, don't hesitate to contact me at orthopedic department so that I can answer your question. Okay, but before I leave you, I will give you some MCQs, okay, and try to answer them. Calcaneus deformity of the foot refers to what? Okay, first option is the normal arch of foot slope. What do you think about that? I think the normal arch of the foot, if lost, we call it bisplanus, isn't it? Okay, the foot is fixed in dorsiflexion. Yeah, maybe this is the correct answer because the foot is fixed in plantar flexion, we call it equinus, but if fixed in dorsiflexion, we call it calcaneus. The fourth option, arch is related, what we call it? Yes, it is cavus foot. What about the last option? Yeah, we call it cavovarus. So the best answer here, or the right answer here, is that the foot is fixed in dorsiflexion. Okay. Another question. What if we mean by anterior inclination of the long axis of the femoral neck with reference to the transcondylar plane of the distal femur? Yes, you are right. It is anteversion. Okay, so what is the type of hip joint? Yes, we have it before. We said that there are three types of the joints. The joints may be fibrous, may be cartilaginous, or may be synovial. Okay, so what is the type of joint? Yes, it is a synovial joint. Okay. Thank you for listening for my lecture. Assalamu alaikum.